1490 WGCH, WGCH.com, anywhere. WGCH News Center time is 8:21. Joined in studio now by Greenwich resident Robin Kanarek, as she has written a book called Living Well with a Serious Illness to talk about palliative care. And Robin joins me in studio. Good morning, Robin.
Good morning, Tony. Thank you so much for having me.
All right. Give us a little bit of background yourself. You're a registered nurse, have been for years.
I've been a registered nurse for 45 years. I went to several nursing schools, but the last one was Fairfield University, where I'm still very involved with their nursing school. And I've lived in Greenwich. I was born in Greenwich and lived here from 1989 until now, with a period of time that we moved abroad to London.
All right. But never did you think that your nursing experience would come close to home, right?
The two areas of nursing I did not want to do when I was a new nursing student was oncology and pediatrics. And this is what life threw me when our son was 15. He was 10 years old when he was diagnosed.
All right. Tell us a little about son David, was your
Yes.
son's name.
David was 10 years old. He had just had a complete physical. Everything was normal. And all of a sudden on Thanksgiving morning, I was preparing dinner and David fell. And he laughed it off, and I asked him if he was okay, and he said yes. And then a couple of minutes later, he fell again, and there was no reason. So I took him to the doctor after the holidays, and they conducted a battery of tests just to make sure that there was nothing going on. And it took several weeks to get the diagnosis, but he had acute lymphocytic leukemia.
That's the bad one, right?
Well, since the 70s, leukemia has become more curable, but at that time, any cancer diagnosis is unnerving, and we didn't know what was going to happen, but the doctors thought that he was going to beat it.
About what year was this?
1995.
Okay. And then tell us what happened from there and how this all played into you writing the book.
David was attending Julian Curtis School at that point, and then he went to Central Middle School, and he was doing very well. He had a 2-year protocol of chemotherapy, and the school and his teachers were extremely supportive. And then right before he was about to start the high school in 9th grade, he went to a sleepaway camp and told the camp counselor that he had deep hip pain and he was having trouble walking. And so he came home and we saw the walk that he had from 4 years prior, and we took him to the oncologist and we found out his leukemia had relapsed. He had come back and it was more aggressive.
Mm-hmm. All right. So then at this point, your nursing care took over?
Yes. I have to tell you, I was in nursing mode in the very early part of his illness.
Sure.
And that's not necessarily what your child wants from you.
You want a mother, not a nurse. Yeah.
Absolutely.
Yeah.
And one day he clearly said that to me. I had asked him what I can do to make him feel better, thinking I could give him a massage or whatever. And he said, Mom, I just want to be a family.
Yeah.
And so he just zapped me into reality and what was important, and I had to put my nurse mode behind me.
Right. Now, how old was he when he passed away?
He was 15.
15. All right. So tell us about when you decided to write this book.
Well, since his death, it took several years of grief counseling to get over. You never get over someone's death, but to come to terms with things and to go forward. And I had a daughter who was 10 years old at the time. And so I started learning from a Fairfield University nursing professor. She had suggested I learn about palliative care because she thought that would have helped David. And so I said, okay, I'm going to learn about this. And as I learned more and more about it, I realized it really focused on a lot of psychological, social, and spiritual issues, which is what David experienced after he had a transplant, a stem cell transplant. And he really had a very difficult time when he was in isolation. And no one, unfortunately, addressed those needs. And I pretty much had to force a doctor to go in and talk to him. And it turned out that David had some existential questions, philosophical questions about life and why this was happening to him. And the doctor came out exhausted because it was a three-hour conversation. And my husband and I expected him to be very sad after this conversation. It was just the opposite. He was smiling.
David was.
Yes, he was relieved. and he was able to go forward. It was just like he needed to unburden himself with all that was churning within him.
Now, this would be considered palliative care, even though it wasn't, quote unquote, a thing at that time?
It would be part of palliative care,
Yeah.
but I mean, it's at that stage, palliative care. What's happening now is palliative care should be introduced very early in the diagnosis of a serious illness. And serious illness is much more than cancer. It's heart disease, kidney failure, Lou Gehrig's disease, Alzheimer's, Parkinson's. These are all conditions that you can live for many years. And so the focus of palliative care is trying to give you the best quality of life possible, because people with these type of serious illnesses can live many, many years. Whereas hospice, on the other hand, is many times confused with palliative care. Hospice care is pretty much end-of-life care. And the doctor has to say and agree that you have 6 months or less to live. But with palliative care, you can receive curative treatment. Hospice care, there's no longer curative treatment.
So living well with a serious illness is about what?
Everything that I've learned from my experience with David. After he died, I started keeping a notebook of articles from medical and nursing journals about leukemia and palliative care, and I kept a notebook. And then over the course of several years, I wrote many medical and nursing wrote in journals, and was speaking at conferences and nursing schools. And then I realized, who's going to educate the consumer? And if the consumer doesn't know about it, they're not going to ask for it. And Diane Meyer, who's out of Mount Sinai, she's the guru in palliative care. And she pretty much said, she's a physician, and she says, if you don't ask for palliative care, you're not going to get it. So I want to give the tools to the consumer as to what they need to ask, how to ask it, and how to prepare for each treatment.
Well, when I think about what the book is about, do you also get into things, for example, as you as a caregiver and taking care of yourself while this process is going on?
That's a big topic.
And the other part is, you mentioned you have a daughter. She's younger than David?
Yes.
So what was it like for her when he's getting, presumably, all the attention? What was it like for her as a young child?
Well, Sarah is now, she lives in town. She's married and is 6 months pregnant. I'm going to be a grandma in August.
All right.
She was 5 years old when he was diagnosed, and we made a concerted effort to include her in everything. She and David were very, very close. When David, after he had a stem cell transplant, he couldn't really see anybody, so she was his best friend, and they were very, very close. It had a profound effect on her. Each of us grieved differently, sure. And I'm the most vocal because I find that by talking about it, each time I speak about it, I heal. Mm-hmm. So for me, that's the way I deal with it. Sarah and my husband are more private and will only share it to very close friends.
And thus the book cathartic for you?
Oh, very much so.
Yep.
Very much so. It was very interesting to validate everything that I felt was in the research. And so I quote all the top leaders in the field: Betty Farrell, Diane Meyer, Steve Pantelot, all the top leaders in palliative care are quoted in the book, and research is also indicated in the book.
Wow. And again, the portion about the caregiver taking care of themselves? Absolutely.
Not themselves, their family. Yes. Caregiving is an exhausting job. And I hope in the future that healthcare organizations will focus more on relieving the stress from the caregiver. Because if the caregiver burns out, then you have troubles.
Right. Well, Robin, it's a book I'm sure you never wanted to write.
No, but David would have wanted me to write it,
yeah.
And that's the reason why I did it.
It's almost 30 years in the making, right?
22 years.
22, yeah. All right. Robin Kanarek, my guest. The book is Living Well with a Serious Illness, and how can people get the book?
They can get it either on Johns Hopkins University Press or Amazon. It's on Amazon.
Was it difficult getting a publisher to write the
No,
book?
as a matter of fact, Johns Hopkins University Press picked it up, and I thought they were a perfect match because I really want to get this integrated into nursing schools, medical schools, social work schools, as well as the consumer. So I think if I can get the nurses and doctors to read about it, and then they can pass it on to the patients.
Great. Well, thanks for a couple of minutes this morning.
Oh, thank you so much, Tony. I really appreciate it.
All right. That's Robin Kanarek, my guest this morning.